Dry the palate and basal C tissue with gauze. Have the patient close and retain the gauze in the mouth. Remember, over-drying the mouth will stimulate salivary flow. If using rubber base impression material, place equal 4-inch length of light body base and catalyst on the mixing pad. Place Vaseline over and around the patient's mouth and lips. Mix until homogeneous. Distribute the material uniformly in the tray using a small cement spatula. Over the borders 2 to 3 mm into the labial and buccal surface of the tray. Place only enough impression material in the posterior of the tray to record the tissues. Excess material will flow out of the posterior of the tray and cause the patient to gag. Remove the gauze from the patient's mouth. Standing to the right of the patient, rotate the tray into the patient's mouth. Place the index finger on the posterior rim and fully seat the tray. The vestibular tissue may be briefly and lightly border molded for about 30 seconds after the tray has been seated. Retain the tray in position with finger pressure at all times. Allow the material to set. Generally, this is 3 to 4 minutes for fast set rubber base and 7 to 8 minutes for regular set rubber base. Remove the maxillary final impression. Inspect the impression to determine if it's acceptable. Disinfect the impression by rinsing excess saliva with water. Place the impression in a Ziploc bag and spray it with the current approved disinfectant. Wait 10 minutes before unsealing bag and pouring the impression. Checklist for maxillary final impression. Labial and buccal vestibular reflection are fully recorded. Pterygomaxillary notch is recorded. Palate and vibrating line recorded without voids or distortion. No tray showing through the impression material. Labial and buccal freni recorded. Uniform color or impression material indicating proper mixing. No large voids or wrinkles in the impression surface.